So good afternoon to everybody joining us for this quite exciting meeting concerning the CytoSorb Therapy in COVID-19 patients. Thank you for the company to give me the opportunity to chair this session. And before getting all the lectures given, I would like just to introduce something related to the immunological staff during COVID-19, which is called the so famous cytokine storm, which is used by everybody in the media or in the scientific journals. So few words about the cytokine storm, to say that this word or term was used around the 90s to globally mention an uncontrolled systemic inflammatory reaction. And this systemic reaction seems to be triggered by very different factors and medical context. It is a term which is quite equivalent to the cytokine release syndrome, which was more related to some specific immune treatment. And then this cytokine storm has different phenotypes, which means basically that you have different type of cytokine response. And this is related with different part of the immune system activation, which is depending on the etiologies. So finally, it's global word, but it's quite vague and really non-specific. So what happens for this cytokine storm application to the COVID-19? If we go to this recent paper from the group of Michael Mattei in San Francisco, recently published with JAMA, they were talking about the relevance or not of the cytokine storm in COVID-19. And here you can see, especially for the plasma level of IL-6, which is the leading cytokines reported in COVID-19 and being or becoming a target for the treatment, you see the comparison between the COVID-19 papers measuring IL-6 levels in severe COVID-19 ARDS compared to the ARDS non-COVID patients, where the IL-6 was also measured in different trials. And you see the level of this cytokines in non-COVID patients were around 1,000, more than 1,000 pikes per ml, compared to the approximately 100 or less in the COVID-19 patients. So finally, the level of non-COVID-19 ARDS was 10 to 40 times fold higher than the one observed in COVID-19 patients, even in the most severe one. And that's an important issue to remember. The level of IL-6 is quite lower in COVID-19, despite the severe ARDS. And this is another paper from the group of Peter Piggers in the JAMA also, showing the cytokine levels in critically ill patients having a COVID-19 and compare with other conditions. And you see the level of IL-6 in logarithmic scales. You see the level of IL-6 is at least 1 log, and maybe more than 1 log, 2 or 3 logs lower than the level of ARDS related to other etiology than the COVID-19. Similarly, for the IL-8 concentrations, you see the level in the COVID-19 ARDS is quite lower than the level reached by the septic, for example, or bacterial-induced ARDS. So finally, is the cytokine storm relevant? So we have finally the question, why are the clinical outcomes in COVID-19 so unfavorable despite a relatively low level of circulating IL-6? If it's low, you should have a good outcome. And 3 potential explanations can be listed. First of all, the lung inflammation during the COVID-19 is not creating the same magnitude of systemic responses than those reported in the prior studies of hyperinflammatory phenotype in ARDS not related to COVID-19. So the systemic response is largely less in COVID-19. The COVID-19 IL-6 levels are more frequently measured by the clinical lab, which are not using the reference technique, which is the ELISA technique. And then we can then underestimate the level of IL-6. And finally, the plasma level of cytokines may not be representative enough of the lung inflammations. In other words, what you measure in the blood, is it related to what happens in the lung tissue? It's not well demonstrated yet. The theory of the cytokine storm in COVID-19, based on this data finally, we can say that it seems to be very weak. So we don't have a real cytokine storm. It's more brain than the storm. And the appropriate conclusion could be that in comparison to other causes of ARDS, the COVID-19 is characterized by lower levels of circulating cytokine responses. And the dysregulated cytokine in COVID-19 is not sufficient to explain the severity. So now we can move to the next speaker,